So now we're going to measure the legs. And again, you want to consider all the different styles on your silhouette chart to see what's most appropriate for the patient. There are a lot more different styles for the legs to consider. Again, I'll remind you that normally or often we do legs and socks in two separate pieces. And we try to do this actually in a lot of different places with garments because it gives the patient more flexibility. Let's say one part of the body opens up again and they need to take off the sleeve. On a sleeve in a vest, if you have a separate sleeve, then they can still wear the vest with short sleeves, even though they can't wear the separate sleeve. And so the same thing happens with the leg. You also want to be sure you fill out the burn assessment chart because it really helps to give you a better fitting garment. The other thing you want to do is remember all your options and to fill them out here, and if you don't want an option, be sure to cross it out so that we know that you've considered it. One of the options with the leg is an open or closed crotch. Of course, if the person is burned in their groin or crotch area, they need to have a closed crotch. But if they're not, often people want the option of having an open crotch. You want to note the zipper placement. With zippers, we're generally always trying to put them where the person is not burned. Sometimes that's not possible, and in that case, you be sure that you have a lining under the zipper. A knee reinforcing means we have single soft or double soft, and single means you have a layer of soft fabric under the pressure garment fabric at the knee joint, which helps with wear and tear, but especially helps with having a smooth surface when they're moving their joint and making it a little easier for them to have pressure on the joint. Double soft is for when they have real problems with their joint and we just do 2 layers of the soft fabric instead of 1 layer of the soft and 1 layer of pressure garment fabric. We do prefer measures in inches, though we will accept centimeters. And you want to use a water-soluble marker when you're measuring. And you want to write dark and large when you're writing because with faxing it can get faded. And you also always want to remember to measure a good 1 to 2 inches past the end of the burn because the garment does lose pressure right when it gets to the edge, where possible. Sometimes there's nothing you can do about that. Another important thing on a leg is to not end a garment mid-muscle. We always end distal or proximal to a muscle, but not mid-muscle. When you start to measure, of course, you circle right or left. And you know, when you're with a patient and they're talking to you or maybe crying and there's a lot of different things going on, these things can, you can get mixed up. So that's why we say circle it, and that helps with that. All our lengths include elastic. So we'll take care of that for you. And now we'll have Van come out to measure the leg. And of course, it's important to have the person standing, especially with legs, standing, looking straight ahead, having good posture, which isn't always easy when someone's burned, but you want to try and have them do that as much as possible. So again, to start with the leg, we're going to assume that we're doing a full 2 legs to ankle. So you want to start with your locator point, that's going to be your 0. Then you want to make all the marks that you're going to need for measuring. The second locator, there's actually 2 locators with a leg, so you're going to start where you're starting, which in this case is the navel. If it were a single leg, it'd be the crotch line. So you're going to take it at the navel. But you're also going to take one at the crotch line. This is a very difficult point to get, and it's crucial to getting a good fitting leg garment. So we'll start with Van's navel, and I'm going to sit down. Okay. So we're going to come around your waist. She's going to try and let us see the truth here. Often our patients, especially our men, they really try and suck it in, but we want the truth. We want the dirt. Okay, so big breath in and out. Okay, good. Okay, so 30 and 3/4. You want to hold that? And you want to mark it in between the two tapes. And you're going to write that right in here. Okay. Okay, now you're going to come and you're going to make a mark, and you make your marks down the center front of the leg. So we're going to make a mark for the hips. Okay, and we're going to take a circumference there. And for the hips, you want it at the largest protrusion of their buttocks. So you get the full story there. Okay. Okay, so what you want to do at the crotch line is you're going to take 3 circumferences for this one length. And again, this is a critical area for getting a good measure. You want to come as high up as you can in the crotch, which you might want to ask the patient to place and make sure that it's right up there, because we don't want to do that ourselves usually. Okay, and then you're going to come straight out and take your circumference. Okay, now you've got your right height, and that was 19 1/4. You've got your right locator. You've got your locator for your waist, your locator for your crotch. Now you make marks going down the leg as often as you want to take circumferences. Of course, you want to get the center of the knee. That's a critical one. And we generally want to end a leg about 1 inch proximal to the ankle bone. You don't want to go right into the ankle bone, just above it. Okay, so now that we've got this crotch line established, we want to come and take our double crotch measurement. So on your chart, these 3 that are on the same length are noted with a star to remind you get to have the same length for those 3. So we're going to have Ann put her feet together, which she did. And we're going to come straight across. And we take our measure there, which is 32. Okay, so we've gotten that, we've gotten this, so now we're coming right down to get the rest of the circumferences going down the leg. So of course we already got this circumference, so we're coming down and getting the rest of them. And again, you don't want to angle your tape. It's very easy to have it angled. It's going to give you a measurement that's off. (18, 16 1/2, 14 3/4). Okay, now we're at the knee. And again, you don't want their eyes to be following you down, especially men tend to want to follow you down, and so we have to keep reminding them to stand up straight. Okay, 13 3/8. Let me double check this one. Continue down the leg. Okay, so now we've got all our circumferences for our right leg. So now we're going to come and we're going to get all of our lengths. So we're starting with our navel, coming down to our hip. Okay. And the reason I do it center front is you do want to follow the contours a bit, but not, you wouldn't want the very center front. You kind of want it between no contour and full contour. Okay, so now we've got our crotch line length. So that's 7 3/8. So we're going to write that here and here, because these circumferences are all on the same line. And we'll mark it here too. Okay, so now we're going to continue down the leg. And we've got 10 3/4, 13, 16. Okay, and now we're at the knee and below the knee. Okay. So of course you always want a length corresponding to each circumference, because the length is telling you where that circumference is for us to draft it later. And again, you want to be sure that you've come to about 1 inch above the ankle bone, and when you measure the sock you're going to go well above that, so that you have good coverage between the two and no gaps. Okay, now if you were to measure a half leg, of course you would come distal to the muscle and you would end it just above the knee at the appropriate place that you decide between you and the patient. I do involve the patient with choosing the style. I find when they're involved a bit, it really helps them to be more compliant with wearing it. So I let them know what I feel should be done for the style, ask them what they think about it, show them what it is on the style chart, and make a decision kind of in collaboration with them. Now there are different styles here as well. We have the chap style. With the chap style you would measure it the same as a leg, and then we extract the chap's design out of that. And of course it goes without saying that you want to remember to take your lengths that you gave your first leg and put those same lengths in for the other leg, barring that there aren't any physical abnormalities that would make you need to use different lengths on the other leg. And then of course get the circumferences for the other leg, and then to know that sometimes one leg maybe a half length and one leg full length, in which case you'd end here for the half leg. So that's our legs, and now we'll go on to the socks.